Hi बच्चों, so I have an antenatal patient here with me and let me show you how Leopold's maneuvers are performed. Very important for your undergraduate exams, for your practicals, viva, and also important for your NEET PG exams. Now, when we are doing Leopold's maneuver, you have to stand on the right hand side of the patient. Please tell the patient to empty her bladder. Adequately, you should cover your patient. Right, that is very important. If it is cold, please warm your hands and then put your hands on the patient's abdomen. Now, when you are doing Leopold's maneuvers, the first 3 maneuvers, they are done when you face the patient, and 4th maneuver is done when you face the patient's feet. First 3 are done when you face towards the face of the patient. Now, before performing Leopold's maneuver, let us see what her gestational age is. For that, we are going to do a fundal height examination. For fundal height, I am taking the ulnar border of my left hand and starting from Ziffy sternum, I am going to come down. And wherever I am going to feel the resistance, wherever I am going to feel the upper border of the uterus, that is the place where the fundal height is. Now, as you can see in my patient, the fundal height is, it is it is 2/3 distance from umbilicus to Ziffy sternum. So either this patient is 32 weeks or this patient is 40 weeks. My patient is 40 weeks pregnant, right? Now, I am going to do the Leopold's maneuver. For Leopold's maneuver, first maneuver, I am going to face towards the face of the patient. Now, facing towards the face of the patient, I am going to use both my hands and I am going to put it in the fundal area. Be very gentle when you are performing these maneuvers. So, I am going to palpate the fundal area. Right, this is what is called as the fundal grip, and this is Leopold's first maneuver. In fundal grip, what I am feeling is a broad and a smooth structure, which means I am feeling the buttocks of the baby. That means the head of the baby is down and this is cephalic presentation, right? Now, Leopold's first maneuver tells you not only about presentation, it tells you about the lie of the patient. How? If you are feeling any part in the fundal grip, that means it is the lie is longitudinal. Because if it would have been a transverse lie, if the baby would have been placed transversely, then the fundal grip would have been empty. So the first thing what Leopold's first maneuver is telling you is about the lie of the baby. In this case, I am feeling something, that means this is longitudinal lie. And as I told you, I am feeling that there is a broad and a smooth part. That means I am feeling the buttocks, which means this is cephalic presentation. Now, if I would have felt a hard, firm, globular structure, that means I was feeling the head and that means buttocks were at the bottom, which means it was breech presentation. From the fundal area, I am going to bring my hands to the lateral side of the umbilicus, right? Like this. Now, I am going to stabilize my one hand and with the other hand, slowly I will try to feel what I am feeling, right? On one side, then you stabilize this side and you try to feel on this side. Now, in this case, what I am feeling is that on the right hand side, I can feel multiple multiple knob-like structures. This means that I am feeling the limbs of the baby on the right side, whereas I am feeling a continuous board-like structure on the left side, which means back of the baby is towards the left side. Now, wherever is the back of the baby, definitely the occiput will be towards that side, right? Wherever is the back, the occiput has to be towards that side. So, because I am feeling the back of the baby on the left side, that means the occiput is on the left side. In other words, this second Leopold maneuver, which is called as the lateral grip or which is also called as the umbilical grip, is telling you what? It is telling you about the position of the baby, right? How? Wherever is the back, at that place is the occiput, and in my patient, the back is towards the left side, which means that the position of the baby is LOA or LOT. So it has to be left position. If back is on the right side, it means the position is right, ROT or ROA or ROP. Now I am going to bring a single hand towards the pelvis area, just above the pubic symphysis. I am going to place my hand, and I am again with my hand trying to feel what I can feel. Now what I am feeling is a hard, firm globular structure, which tells me that yes, the presentation is cephalic. Now try to move the head of the baby from side to side. Right, this is what is called as this. You have to move it from side to side. This is called as ballotability. Now in my patient, I cannot move the head of the baby from side to side. Right, that means that the head of the baby has entered the pelvis, and that means head of the baby is fixed. So Leopold's third maneuver, which is called as the Pollick grip. What does it tell you? It tells you about the presentation, and also it tells you about ballotability, that whether the head is ballotable or not. In other words, it tells you whether the head has entered the pelvis or head has not yet entered the pelvis. If head has entered the pelvis, you say that the head is fixed. Clear? Now, once I am done with Leopold's third maneuver, now I have to change my position and I have to see towards the feet of the patient. Now I am going to face towards the feet of my patient and perform Leopold's fourth maneuver, which is called as the deep pelvic grip. Now keep your fingers parallel to inguinal ligament and try to palpate what you can feel. Okay, what I can feel is again a firm globular structure, and that reconfirms to me that this is cephalic presentation. Now I am going to try to bring my fingers below the presenting part. Now when I am trying to bring my finger below the presenting part, I am unable to go below the presenting part, and my fingers are automatically diverging. Now because my fingers over here are unable to go below the presenting part no matter how much I am trying, right, and they are diverging, this means the head of the baby has entered the pelvis. If your fingers can go below the presenting part and they converge, that means head has not entered the pelvis, which is not in this case. In this case, I am unable to take my fingers below the presenting part. So what is Leopold's fourth maneuver telling you? It is confirming the findings of Leopold's third maneuver. It is telling you number one, presentation. Number two, it is telling you that the head of the baby has entered the pelvis, right? And third thing, one additional information which Leopold's fourth maneuver gives you is about the attitude of the baby. As of now, in undergraduate level, you don't need to know how you come to know about the attitude of the baby. Now, just one thing which I want all of you to understand. When head of the baby enters the pelvis, we say that the head of the baby is fixed, right? Engagement and fixed are two different things. Please understand, bacho, that when you are feeling the head of the baby, right, now you have to see that how many fingers of yours are required to cover the entire head. Normally, all your 5 fingers are required to cover the entire head of the baby, and then you say that the head of the baby is 5 by 5 palpable, right? Now suppose head of the baby enters the pelvis slightly. When the head of the baby enters into the pelvis, you say that the head is fixed. Now suppose only 4 fingers are required to cover the head, right? So you will say head of the baby is 4/5 palpable, but the head is fixed because it has entered the pelvis. Now suppose head goes deeper inside and 3 fingers are required to cover the head, so head is 3 by 5 palpable. Now head goes more deeper and only 2 fingers can be taken onto the are required to cover the head of the baby. Then you say head is 2/5 palpable. Now the moment head is 2/5 palpable per abdominally or less than 2/5 palpable per abdominally, then you say that the head of the baby is engaged. So when I am doing Leopold's fourth maneuver, not only I can come to know whether the head is fixed or not, simultaneously with my fingers, I can come to know how much of my fingers are required to cover the head of the baby. Now in this case, my 3 fingers are covering the entire head of the baby, which means that although the head is fixed, It is 3 by 5 palpable per abdominally. That means it is not yet engaged, right? So the head of my patient is not yet engaged. Clear to all of you? Remember, engagement in primary gravida happens around 38 weeks of pregnancy, whereas in multigravida patients, it happens at the onset of labor. Clear to all of you? One last thing which I want you to know is that per abdominally, if you see in this patient, there is such a nice baby bump. Do you see over here? That area below the umbilicus is not flat, right? Now suppose in some patient you see that area below the umbilicus is flattened. That is subumbilical flattening, and that means that it is occipito-posterior position. In occipito-posterior position, fetal heart sounds are heard near the flank of the mother. Whereas this is a typical case of occipito-anterior position, and here the fetal heart sounds will be heard close to the umbilicus. Clear to all of you?